Welcome, everyone. We are so excited to be back here at Going Digital Behavioral Health Tech. My name is Haleigh Tebben. Welcome, everyone. I am the Chief Commercial Officer at Brightline. If you haven't heard of Brightline, Brightline is the first and only national comprehensive pediatric behavioral health solution. We support kids and teens a year and a half to 18, along with their families. And we do that through a comprehensive model that includes both self-directed tools, resources, content within our digital platform, as well as one-on-one virtual behavioral health coaching to focus on skill building for children and teens, things like not sleeping in their bed at night, nervous to take a test. We also do support clinical needs with a full team, including speech language pathologists, psychiatrists, and therapists. We're very excited to be offering it in all 50 states. And I'm so honored to be here today with Sarah Iselin, Executive Vice President and Chief Operating Officer from Blue Shield of California. Sarah has quite the impressive background. She has over 30 years of experience in healthcare strategy, policy, finance, and philanthropy, having served in senior leadership roles at Guidewell, Florida Blue, Optum Federal, and BCBS of Massachusetts. She's also spent time in the state government in Massachusetts, both in leading the highly visible and successful turnaround of Massachusetts implementation of the ACA and Health Insurance Exchange website in 2014, and serving as Commissioner of the Division of Healthcare Finance and Policy. She earned her Master's of Science in Health Policy and Management from the Harvard School of Public Health and a Bachelor of Fine Art from the School of the Art Institute of Chicago. Happy to have you here today, Sarah. Looking forward to talking with you. And I just wanted to maybe have you kick off a little bit and talk about Blue Shield of California for those that maybe haven't heard of Blue Shield. I'm sure they have, but just in case. And also share a little bit about why pediatric behavioral health is so important to the Blue Shield team.
Well, thank you. It is my honor and pleasure to be here. I love our partnership, and I'm really looking forward to this conversation. So Blue Shield of California is part of the Blue Cross Blue Shield family of companies. We are a mission-driven, not-for-profit, statewide Blue plan that serves residents of California. And we are focused on creating a healthcare system that is worthy of our family and friends, and is also sustainably affordable. We have 4.7 million members. We've got more than 7,000 associates who we work with in service of all of those members. We're about $23 billion in revenue. And one of my favorite statistics about Blue Shield is since 2004, we've invested more than $800 million in the communities that we live in and work in and serve. And to your point around, why does pediatric behavioral health matter to us? Well, it matters to us because kids are our future. And we know that in spite of lots of wonderful people, including everyone at Brightline, there still is really significant stigma around mental health and behavioral health. And we want to be a part of helping provide access to behavioral health services for kids and families that need it. And we know that really those needs have never been greater than they are as we're sitting here, as we're shifting from pandemic to endemic, but at this moment in time. And that the barriers include just finding access to providers who take health coverage, who have availability of appointments, transportation barriers, and that it I think matters now more than it's ever mattered because it's the right thing to do.
It's so true that it's such a needed service. 1 in 5 children in this country have a diagnosed mental health condition. Another 1 in 5 are potentially undiagnosed, it's estimated. And it feels like when I'm at Brightline having conversations each and every day with employers or members or clients, everyone has a story, everyone has an experience, that it matters to so many people. And from your perspective, Sarah, why does it matter so much to you personally? If you wouldn't mind sharing a bit about.
And thank you for asking. One of the things I know you know about me is I am so happy to share my own story because this is personal. And I think when we share our stories, part of what we unlock is that everyone has a story. Whether it's my story, I've got 3 kids, 3 young adult children, hard for me to believe, and 2 of my 3 children. And I say this with their support and permission because we all realize that talking about our story is a really significant contribution we can make to making an impact on breaking down the stigma around mental health in general, and particularly mental health for kids and families. So 2 of my 3 kids suffer pretty profoundly with depression and anxiety. I'm happy to say they're in a good, stable place because they've had access to extraordinary providers in the mental health care system. But, I spent a year and a half with a kid who's now 21 and about to finish college, but in treatment. I've been in a locked psych emergency room with my oldest child twice. And there's nothing like going through that personally to really also understand that the system isn't serving people who know how to navigate. I work in healthcare. I know how to navigate this, that it isn't serving the needs of kids and families as well as it needs to. So it's personal, and it's personal for all of us because we all know someone who has a story. We all know someone who's struggling.
Thank you for sharing that. I think you're right. Talking about it does help with the stigma and breaking it down. I know that it affects so many of us in this country, in this world. Mm-hmm. And we are so grateful to have such a strong partnership with Blue Shield here at Brightline. So let's set a little context. One is you, I think if I remember this correctly, are our first client at Blue Shield of California. And also we are partners. So do you want to talk a bit about our partnership and our relationship and why you chose to partner with Brightline so early on?
I would love to. And some of this preceded me joining Shield. So this is me taking credit for a lot of strategic thinking and work done by lots of my colleagues and by you. Yeah. But we're just deeply committed to supporting pediatric and youth mental health. And that's reflected not just by our early partnership with you, but also we've made significant investments that are not just for our members or for our employees, but in community investments. We have an initiative called Blue Sky, where we partner with schools and community agencies that's focused on increasing access and awareness and advocacy all across California. So this is just a huge priority for us. And we've just seen the need for behavioral health care for kids, and the shortage of providers become a bigger and bigger issue. And so we were looking around for solutions. We're lucky to get you guys on our radar screen. We were incredibly impressed with your model. And it is part of how we are addressing, on behalf of our members, this critical shortage of mental health providers facing kids. We know that 1 in 6 kids in the United States is being diagnosed with a mental health condition every year, with higher rates, depending on, different circumstances, youth of color, LGBTQ youth experiencing poverty and other adverse childhood experiences. Some of them have even higher rates than that. So, you just look at those statistics, those alone should be enough to compel people to really work on integrating behavioral health care and resources into pediatric primary care and working to identify and support providers meeting this need. So we were super excited about your technology platform. You guys from the beginning have been outcomes oriented, which is just so, you know how to talk to health plans. We talk ROI and you talk ROI. So it isn't just about access. It's really around thinking about getting outcomes. So we really saw you as being differentiated in this space, in part because you are solely focused on kids and families and their caregivers.
Yeah, it's interesting. When I was first considering joining Brightline, I remember even just Googling to figure out, who else is doing this work around pediatric behavioral health? And I was shocked to see no one. The fact that no one had tackled this from a systemic, comprehensive way to really support kids and teens and think about how to do it holistically, measure improvement over time, really focus on quality and outcomes. So completely agree. I think too, it's new though. And when you think about employers, really embracing, which has been fabulous, behavioral and mental health over the last 5 to 10 years. Pediatric behavioral health is new for employers. And so would love to hear from you as you've brought Brightline to employer clients. What has the feedback or the reception been?
Well, and let me also share with folks that we even started the rollout as an employer. So we first brought it to our own base of employees. And so I'd love to just share a little bit as I was thinking about preparing for this. We actually pulled some quotes from folks who've used Brightline. So I've got to put my glasses on so that I can actually read them. But I think there's nothing more, I could tell you, but let me share it in actually your clients, our members and employees' words. So I'll just give you a few little snippets. So here's one. This is a quote. Unfortunately, the new norm and expectation for quality child therapy is wait, drive. Brightline defied this new norm and provided quality, structured therapy for my child within a matter of days. And we've been able to sustain the sessions because of the ability to do the sessions from home. By the way, I'll just pause before I read you a couple of others. I mean, we know some families are facing waits that can be weeks. Our experience with you it's been days. So for folks who need access to therapy, you're bringing a solution to our employees and our members that gets them access to therapists and coaches within days. So that's just profound and consistent with the feedback that we get. So I'll give you a couple of other ones. Another quote, I had a great experience overall, from the intake process to member services to coaching experience and follow-up. The experience was very smooth and I loved everything was online. I learned a lot from my coach and so did my child. And another one, it was quick and easy to get started. It's covered by my insurance. The resources and support team are excellent. And finally, another, Brightline was there for us at exactly the right time. This is a family with a kid who had a lot of anxiety about being in a car. And the family was actually in a car accident they were safe, but between the car accident and the child's anxiety about going back to school, having a coach on board during a stressful time was a lifesaver. So I think better than just for me to say it is to share what we're hearing. And that point around timely access to care and that mix of access to therapists and coaches and engagement of parents and caregivers, that's been just really consistent about the positive feedback that we've gotten from both our employer clients and our own employees. And so will you humor me a little bit? I get a little tired of hearing myself talk, as you can probably hear, because I'm reading other people's words. And let me flip a couple of these back to you, just so we can make it a conversation.
Would love to.
All right. So I'd be really curious to hear, you mentioned that we were the first, but obviously we've been keeping in close touch with you guys. So I know you're growing like crazy. And I'd love to hear you talk a little bit about, what are the best client relationships? What clients are the best fit for you? And I know we're all thinking a lot right now about state guidelines and telehealth rules. So would love to hear a little bit about how you're navigating that and therefore who you can serve.
Yeah. Thank you so much, Sarah. It's interesting. When I first joined Brightline and we were thinking about, how we're going to bring the product to employer clients and through health plans, I had visions in my mind of what types of clients would want to come on board with Brightline. I'd been a consultant in health and benefits for a number of years, and it felt like our early adopters always tended to be companies in the tech space or companies that really focused on adding more and more benefits for employees. And what I've actually found with Brightline is we really don't have one type of client, which is so heartwarming for me to know that right now, we all know that with COVID and with the lines between work and home just continuing to be blurred, employers that truly care about retaining and supporting their talent and broadening what they offer to more the family unit, which is what's becoming kind of the employer world, because you're working from home, your kids are at home, and it just kind of becomes a focus on how do we support our employees and families broadly. We've seen every industry, we've seen every size employer. One of our actual first clients, in addition to Blue Shield, was a highly regulated utility company in the Midwest. I would never in my wildest dreams have thought they would be one of the first clients that we would bring on, but they really truly value their employees and they want to continue to offer holistic family-friendly benefits, and they want to retain their people. We hear a lot about people leaving the workforce. 21% of people that we interview actually say they've considered or have left the workforce to care for the behavioral health needs of their child. Mm-hmm. So I think any employer, leader, CEO out there that really truly values their people and want to be supportive of their people so they can keep them and can retain and grow them is really a fit for Brightline.
Yeah.
I've been excited.
So I shared a little bit about why we at Shield decided to work with you. And it's really, our view is kids aren't just miniature adults. They really have a unique set of needs, and this aspect of knowing how to engage parents and caregivers alongside kids was a big part for us around why we thought it was important to have a youth-focused, a pediatric solution alongside our adult behavioral health options, of which we have a number. But I'm curious, as you're talking to other, whether it's health plans or employers, are other people seeing it the same way? What's been your experience? And how do you talk to them about what you guys are doing and why they should have it alongside a solution that is, perhaps more aimed at adults?
Yeah, it's interesting you say that. I say that too. Kids aren't tiny adults. You wouldn't take your child to your primary care physician. You wouldn't go to a pediatrician yourself, right? So they are very unique and different. Adult solutions, it's been phenomenal to see the support and the adoption of the adult solutions by employers. But when you think about the adult solutions, they are built for adults. And if you even think about just adding childhood therapists into that kind of a model, it just exacerbates that situation of just therapy versus a solution like Brightline that has been built from the ground up for kids and teens, our language, our graphics, our model. So we actually help parents and caregivers triage and understand what their child needs. We are the only company to offer coaching for kids and teens. And if you think about, you can't even hire every therapist in the country to support the need if that's the direction you wanted to go. So there has to be a different way to deliver care. And so our model being built for kids and teens, we start with a platform that triages the situation and helps understand what the needs are. We move into coaching or care depending on the needs. And that's very unique. And you can only do that if you have a model that's built for kids and teens. So we have actually been very pleasantly surprised at the realization that they can live alongside each other. They serve very different purposes and audiences, and that bringing both together holistically and referring back and forth when needed for support is really the model and the path forward.
I love that. That so resonates with me. We have multiple adult solutions. Different things work for different people. And as you said, and kids and adults are different.
Yeah.
Where do you want to go next?
Well, I think the point you bring up is the differences too in the model, the fact that we bring the family in. A lot of times when you're a parent or caregiver and you bring your child to a therapist, there's a lot of things that happen. One is, typically you're one step removed from the care that your child is given because you're not in those sessions. And so as a parent or caregiver, lots of times you actually take your child out of therapy because you're not sure if they're getting better or not. Also, parents or caregivers are typically part of the solution to supporting that child. So parent-focused training intervention is part of the care path and care plan. So the fact that the parent is involved in our system of care, they're seeing if their child's getting better because we are tracking clinical outcomes across the board. Only 20% of providers today do that. Very unique and very different. I think that's also why it makes our model more effective. So maybe going back to you, if you don't mind,
all right.
Would love to hear from your perspective. You see a lot in innovation. I'm sure you've got a lot of ideas that are brought into Blue Shield, and you see a lot of providers and digital health companies popping up. What do you think the future of behavioral health looks like from your perspective? Like, what do you think we need to focus on, or what do you think is going to come in the future?
it's such a big question. So there I have a lot of different places that I could go. The first thing off the top of my head is just this notion of integration. I think there is finally a recognition that, we don't just show up as people with, we're not divided between the above the chin and the below the chin. We're whole people. And that we really need to focus on integrating behavioral health care and treatment and treat people as whole people. And that point that you were just talking about, in many ways, it's also not just true of kids, but we also need to think about how do we integrate caregivers, parents in the case of kids, but caregivers in the case of adults in order to really support people achieving the health they want. So I think this notion of integration is really profound and also really hard to do, and a reorientation of, in some cases, the way the healthcare system's been organized, and in some cases, the way payers have been organized. So I think we're having all the right conversations. I think we have a lot more work to do to really get there. But I think there's just broad recognition right now that for some of the most vulnerable members of our society, those who may be struggling with more than one chronic condition, if you think about you're struggling with, if you were struggling with diabetes and heart disease or, cancer, how could you not also be struggling with some level of behavioral health challenge? And we have to really support people in that way better than we are right now. And then I think another trend is going to be virtual's not going anywhere. And so I think this has been one of the real silver linings of the pandemic has been, a reorientation of the healthcare system to make virtual care more accessible and available. And I think that's helped particularly in the mental health space. It's making it more accessible because you don't have to, get in a car. It is frankly, making access to it at times that work for families. This is particularly an issue with kids, right? Where you got to consider, do you need to take a kid out of school? Does a parent need to take time off work? I think just making it virtual has actually just almost lowered the barriers to entry, almost sort of, it's not just logistically, I think it's also as it relates to, stigma that might have otherwise kept people from pursuing the care that they or their families needed. And so I don't think that is going to go away. So I think we're just going to see more of that. And I think we both touched on this earlier. We are thinking about this in terms of how we design our health benefits, both the products that we offer as a health plan. But I also think employers are in this space. Some of their workforce might get health benefits through a partner or a spouse or through government-sponsored insurance, even though they work for that employer. I think those employers are realizing they have a role to play outside of even their provision of health benefits. So whether that's through their employee assistance programs or doing what we did, which is making programs like Brightline available for all employees, because I think people are really, you referenced the statistic about how many people are leaving the workforce because of caregiving needs. I think people really understand this is a productivity issue. It's a retention issue. So I think we're just going to see more and more of that. And I think it's here to stay. I don't think it's just a pandemic related issue, though clearly the challenges related to the pandemic have been pretty profound. But what's your perspective? What do you think the future looks like?
I want to plus 1,000 on your integration piece. I think that is just critical. And even when we look at our Brightline platform, the fact that we've integrated speech language pathology, medication management, therapy, coaching all together, we've been focused on how do we integrate the experience in a way when kids have a mental health issue, they usually have multiple things going on. And so as a parent, you're typically having to make multiple appointments, get on multiple wait lists, drive your kids all over the place. So I think we've been thinking about how do we, in the product that we've developed, continue that integration path, but then also how does it integrate with their primary care physician or with their school? School systems, obviously, where a lot of behavioral health issues are actually identified. So I think we're on that path as well of thinking how that integration piece comes. People expect it. So I'd plus 1,000 on that. I think in addition, the old days, like you said, of going to an office or sitting down on a couch or having those one-on-one therapy sessions. In fact, 70% of US counties don't have a childhood psychiatrist even available within the county. And so this idea of one-on-one therapy just to solve the problem is not going to solve it. And so at Brightline, we're really focused on how do we evolve the care model, the way care is delivered. Teletherapy is obviously the first step, but we know that not everybody has a clinical need. I think a lot of times when you are a parent or caregiver and your child has something wrong, you either run directly to the pediatrician because that's your trusted place to go, or you get on the therapy wait list. And maybe you don't need that therapy, but you're on a wait list for 5 or 6 months. And so really opening up the model and thinking about how can we support needs with other solutions. So coaching, as we talked about, working on skill building, working on things that maybe aren't clinical in nature, but getting it tackled earlier. About half of severe mental illness happens before the age of 14. And right now, most of what we design in this country with therapy actually happens post that age. And so if we can really think about ways to intervene earlier with different types of interventions, we can hopefully help children on that path at a much earlier age. And so we were thinking about things like delivering care via asynchronous content intervention, group-based care, peer-to-peer support. A lot of children and teens, love that peer-to-peer piece. So how do we use peers to deliver some of that care? So I really think beyond some of what you mentioned already, Sarah, how do we continue to just evolve the way we can deliver care so we can deliver it more broadly, more affordably, as you mentioned, one of the goals of Blue Shield of California, and also tackle it earlier on so we can help these children at a much earlier age because they are the future of our country and our world, and they're our most valuable asset. So that's what I think about. And our in-house content team is just always thinking about that kind of stuff at Brightline. And we're excited to partner with organizations like Blue Shield to continue to bring that to employers and to employees. And thanks to everyone for joining us. We are so honored to be invited to this event and look forward to being here each and every year. So hope you all have a great rest of your day. And if you're interested in learning more about Brightline, you can visit our website at hellobrightline.com.